everyone, my name is Angelique Cynthia Caroline. My student ID number is 2002511068. Now I would like to tell you about the background of our student project. Blood streams all through the body as a medium that conveys supplements and oxygen to tissues and all cells. It also conveys byproducts back to excretory system for removal. For preserving homeostasis, such transport is crucial. Hence, blood tests are quite possibly the most well-known test or additional tests to be performed. By doing blood tests, we can monitor the health condition of our body. One sort of blood test is erythrocyte sedimentation rate, ESR. It tests how easily the erythrocyte settle at the bottom of a test tube, which contain an anticoagulated blood sample. It is not specific to any particular condition, but it is used to assess the existence of increased inflammatory activity in combination with other laboratory examinations, medical history, and physical assessment. Therefore, it can greatly benefit the doctor or other healthcare professionals in diagnosing and treating the patients with such conditions. Here are the problem formulation. First is, what is the overview of ESR? Then, what are the stages of erythrocyte sedimentation? What are the factors affecting ESR? What are the indications of ESR? What is the procedure of ESR? And then, how is the interpretation of ESR? The objectives are to define the overview of ESR, to explain the stages of erythrocyte sedimentation, to clarify the factors affecting ESR, to explicate the indications of ESR, to elucidate the procedure of ESR, and then to decipher the interpretation of ESR. The benefits are, writing this student project will enhance our knowledge and understanding of ESR as one of the blood examinations and additional examinations. In addition, the student project is also expected to be a reference for other research related to ESR.
Hello, my name is Gusti Frangipani Vedanti. My student identification number is 20025111064. Today, I'd like to tell you about the definition of ESR. ESR, or erythrocyte sedimentation rate, is a common hematology test to describe changes in protein plasma to monitor the presence of inflammation. ESR calculates the rate at which erythrocytes fall throughout a certain period of time, usually 16 minutes and millimeters per hour in the plasma from a blood specimen that has already been placed into vertical, narrow, and thin tube. The principle of ESR test is that if anticoagulated blood is allowed to stand vertically, the erythrocyte will settle progressively to the bottom and leave plasma above due to its gravity. And millimeters of plasma which present at the top portion of the tube are reported as the results. ESR is a non-diagnostic and sensitive test that is used as a general physical condition marker and able to support the diagnosis related to therapy and prognosis, while it is combined with clinical history, physical examination, and other laboratory tests. In 1973, International Council for Standardization in Hematology adopted the Western method as the gold standard for ESR measurement that is still widely used nowadays.
Hello, my name is Tyas Wirawan, and my student ID number is 2002511082, and I would like to present about the stages of the erythrocyte sedimentation process. This process consists of 3 stages: aggregation, settling or precipitation, and packing. At the beginning, each red blood cells tend to repel one another, forming a specific formation called the rouleau. The rate of the rouleau formation influences the outcome of the test. That's why this first stage becomes the most influential phase in ESR. Next, we have setting stage, or the precipitation stage. As the mass and the density of the rouleau formation increases, erythrocytes fall faster to the ground at a constant speed. This stage, also called as the sedimentation stage, that occurs within 40 to 60 minutes. The last stage is packing stage. The rate of the sedimentations is slowing down to zero at this point, and the cells start to pack at the bottom of the tube. Thank you.
Hello, my name is Ngurah Pratama with student ID number 225-11061. In this presentation, I will cover about chapter 2.3, factors that affecting ESR, especially number 1 and number 2. So, number 1 is erythrocyte aggregation. Erythrocyte aggregation can be influenced by several factors such as the concentration of fibrinogen in a blood plasma, the presence of friction and deformability, as well as density of the surface charge of red blood cells. Erythrocyte aggregation has an important role in monitoring the progression of diseases such as thrombosis and sepsis. Through monitoring using photometric technique. Next is technical factor. Several technical factors affect sedimentation rate in blood sample analysis to calculate ESR, such as variation in a room temperature, sun exposure, time collection, aggregation degree of the tube, and other vibration in a laboratory. The factor number 1 is room temperature. Room temperature has an effect on blood viscosity, which has a direct effect on ESR. An increase in temperature allows an increase in ESR. Next, exposure to direct sunlight results in decrease of ESR. Tube orientation by 3 degrees from the vertical direction can increase ESR by 30%. Improper filling of blood can cause blood bubble, which can increase the ESR. Too long ESR measurement can spread off the red blood cell and cause decrease in the ESR value. And the last, an inconsistent internal borehole ESR2 can receive sensitive stimulation from red blood cells clump, which cause variation of the ESR value. That is all for my presentation. Thank you.
Hello, my name is Stephanie with student ID number 2002511083. So the next factor is the Rolex factor. An increase in Rolex formation is due to increased plasma proteins such as haptoglobin, ceruloplasmin, alpha-1 acid-glycoprotein, alpha-1 antitrypsin, and C-reactive protein or CRP, whereas globulin contributes at least. So the fourth factor is the plasma. Plasma is a liquid base consisting of fibrinogen ascoagulant, plasma protein, for example, albumin and globulin, electrolytes, and immunoglobulin. Concentration of fibrinogen, albumin, and globulin affects the rate of ESR. Higher concentration of fibrinogen and globulin increase the ESR, but higher concentration of albumin decreases the ESR.
My name is Irrene Carla Audithia Pranadiningrum with student identification number 2002511075. I will explain about the physiological and pathological factors that can influence the ESR values. The first one is physiological factors, include age, sex, pregnancy, and lifestyle such as physical activity, smoking, and alcohol consumption. The ESR is generally higher in females than in males and can elevate progressively with age. Higher ESR values are found in individuals who smoke. Meanwhile, lower ESR values are found in light alcohol drinkers and individuals who practice minor physical activity. Pathological factors that can influence the ESR include common metabolic abnormalities, anemia, arthritis, kidney disease, polymyalgia rheumatica, rheumatoid arthritis, thyroid disease, etc. The ESR elevates in patients with metabolic syndrome and patients with complication of alcohol abuse. Nevertheless, in patients with inflammatory disease, moderate alcohol consumption displays a decreased ESR values.
Hello, my name is Nadya Zalfa Aqilah with student identification number 2002511179. In this occasion, I would like to explain about the indication of erythrocyte sedimentation rate. So, ESR, or the erythrocyte sedimentation rate procedure, is considered to be simple, affordable, and non-specific hematology examination that has been used for years in medical field to help clinicians in order to identify inflammation affiliated with other circumstances, for instance, infection, cancer, and autoimmune dysfunction. Since an elevated response from the Esr test always suggests the appearance of inflammation but somehow cannot precisely inform the clinician where the inflammation is located or what tend to cause it, therefore this test is widely known as the non-specific examination. Moreover, the procedure is used in tandem with other measures as well in order to be efficient. There are varieties of factors that may result in ESR procedure. Women appear to significantly elevated erythrocyte sedimentation rate relative to men, so ESR can also increase by pregnancy and aging. And ESR may increase by anemia, RBC, defects, technology variables such as distorted ESR tubbing, elevated heat of the sample, and dilatation value.
Hello everyone, my name is Huliana Lim. My student ID number is 2002511080. Here we will going to talk about the procedure of erythrocyte sedimentation rate manual method. We have two manual methods. One of them we call it Esr method. The fact is, this method is the gold standard of ESR determinations by International Council for Standardization in Hematology. The equipment or instrument we used for this method is the glass or plastic tube and the rack. For the tube, we call it Westergreen tube, and it was aligned with open at the both ends. Okay, for the steps, for this method initiated by collecting blood from antecubital vein using syringe with EDTA for anticoagulation, and then we mixed thoroughly and diluted with the comparison 4:1 for blood and 1 for natrium citrate or natrium chloride. And the diluted sample is aspirated and transferred to the Westergreen tube. And next we place it in a vertical and stable position in the rack for 60 minutes and measure the height of RBC. Okay, next one we will going to talk about the windrobe with my friends. Thank you.
Hello, my name is Satria Wedananta and my student identification number is 20025111071. So the windrobe method. Windrobe method is one of the methods that can be used to effectively measure ESR. The principle and method of this procedure is similar to that of Westergreen method. The windrobe tube used in this procedure has a smaller diameter and length compared to the tube used in the Westergreen method, measuring only 100 millimeters long. In this method, the rate of sedimentation will be measured by using EDTA blood. Due to the shorter column used in the windrobe method, the results are less accurate. However, the smaller size of the tube allows for less blood requirement for the test and also removes the need for dilution of the blood. For this reason, the same tube used in this method grants it the capability of being used to determine hematocrit. So to perform windrobe method, you would need a glass tube with closed end the lower end, with a length of 11 centimeters and internal and total diameters of 2.5 millimeters and 3 millimeters respectively. It is also important to wash the tube properly before usage, as bad cleansing of the tube might lead to erroneous results. An anticoagulated EDTA blood, pipette, timer, and windrobe stand should also be prepared for this procedure. Normal values for the reading of windrobe method is 0 to 7 millimeters per hour for males and 0 to 15 millimeters per hour for females. The rest of the method is the same as the Westergreen method.
Hello everyone, my name is Chintami Gemma Masella and my student ID number is 2002511070. I'd like to tell you about the automatic procedure of ESR. As we all know, in the 21st century, an automatic ESR measurement instrument test one, such as Halifax and Padova, has been developed and marketed. This system measures in slight volumes around 150 microliters of blood, utilizing a microagglutination method that evaluates the interactions between RBCs and inflammatory plasma proteins. The Olifix Roller 20C Analyzer, for instance, measures aggregations and sedimentation at the same time by optical density and ESR using the infrared microphotometer around 950 nanometers. Brief explanation: the blood is simply disseminated in our capillary and hydrodynamics control its movement. 20 seconds is the amount of time where the aggregations and sedimentation is read at 1,000 times. The electronic signals gauged during period are directly related to the amount of red blood cell in capillary section that are showed by receiving photodiode. By meaning, the measurements of ESR is based on the impulse gauged per unit of time.
Hello, my name is Justin. My student identification number is 2002511081. Today I will present about the interpretation of the Esr test. So the result of the Esr is reported as the millimeters of plasma that are present at the top portion of the test tube after 1 hour. It is read as millimeter per hour. The normal range for an adult male is less than 15 millimeter per hour, and for an adult woman is less than 20 millimeter per hour. The normal range for an elderly male is less than 20 millimeter per hour, and for an elderly woman is less than 30 until 40 millimeter per hour. The normal range for a pregnant woman is around 18 to 70 millimeter per hour. The normal range for kids is less than 10 millimeter per hour. A single elevated ESR without any clinical findings cannot give enough information to make a medical decision. A normal result for the Esr test also doesn't rule out the possibility of inflammation or disease. An elevated Esr doesn't always occur with inflammation, but they could occur with anemia, infection, pregnancy, and aging. A high Esr usually has an obvious cause, for example, a severe infection or inflammation, an immunology diseases, hemolytic anemia, or other dangerous diseases. Meanwhile, a low Esr reading could indicate a heart failure or poikilocytosis, or commonly known as an abnormally shaped red blood cell. A health professional will typically use standard tests to follow up the high Esr reading, all depending on the patient's symptoms. Thank you.
My name is Siputu Aptika Dharma Yoga, and my student identification number is 2002511084. So now I would like to summarize all of my friends' explanation about ESR. So firstly, we should know what is the definition of ESR. ESR is a common hematology test that measures the rate at which the RBCs settle in millimeter per hour. RBCs can settle in narrow tube because of gravity, and then the mass density of RBCs that is greater than plasma, and also RBCs aggregation to form rouleaux. If we would like to calculate ESR, we can choose any option of instruments, either using manual or automatic methods. But the gold standard methods of ESR is Western green. When we calculate the ESR, many factors can interfere our results, like RBCs and then plasma protein, technical, physiological, and pathological factors. The normal values of ESR are typically higher in females than in males and will increase gradually with age. However, these normal values can't be used for diagnosing any diseases, except if ESR is combined with other laboratory tests. Okay, that's all our explanation about ESR. We are sorry if we had any mistakes during explanation. Thank you for your attention and goodbye.